Hello everyone, and welcome to my channel. I am Dr. Renee, and I am board certified in infectious disease. For all of my subscribers and the people that have been tuning in to my other videos, you know that I've been mainly talking about sickle cell disease and my son's bone marrow transplant journey. But today I decided to deviate a little bit from that to talk a little bit about monkeypox. I've been getting a lot of questions about monkeypox, and I just wanted to come on and answer some of the common questions that I've been asked. So the questions that I will answer today are: what is monkeypox? When do monkeypox symptoms appear? What are signs and symptoms of monkeypox? How long do monkeypox symptoms last? And how can you protect yourself from the virus? So, what is monkeypox? Monkeypox is caused by infection with the monkeypox virus. The virus was named monkeypox, but the source of the disease still remains unknown. This particular virus is a part of the family of viruses called the variola virus, the virus that causes smallpox. Although the symptoms of monkeypox are similar to smallpox, the great news is that the symptoms are much milder and are rarely fatal. So that brings us to the next question. When do monkeypox symptoms appear? So monkeypox symptoms usually start within 3 weeks of exposure to the virus. Some people might get flu-like symptoms with the appearance of the rash 1 to 4 days later. It can be spread from the time symptoms start until the rash has healed and all the scabs have fallen off. The next question that I'm commonly asked is, how long should you expect the illness to last? This illness typically lasts between 2 to 4 weeks. The next question is, what are signs and symptoms of monkeypox? The signs and symptoms of monkeypox varies, just like it does with your typical virus. Some people might develop fevers and chills and have your typical flu-like symptoms. Other people might have headaches, muscle aches. Some people might have other respiratory symptoms, and that might include sore throats, a cough, or nasal congestion. Sometimes people, again, might have flu-like symptoms before they developed a rash, and conversely, other people might get a rash first, followed by other symptoms. So it's variable, and it really depends on the individual what symptoms someone might actually get. So the other topic I wanted to cover and focus on is what to expect if you develop a rash. People with monkeypox can get a rash on any part of the body, and that can be anywhere from the face, the mouth, the chest, the extremities, and as well as on or around the genitals. The rash typically looks like either blisters or pimples, and it can be itchy and very painful. So again, the symptoms might vary, and the actual rash itself, the symptoms and depends on the individual. But generally, the rash will go through several stages, including a stage where the lesions will turn into scabs before healing. The next question that I get often is, how is monkeypox transmitted? It can be spread to anyone through close contact, often from skin-to-skin contact, including direct contact with monkeypox rash, scabs, or body fluids from an infected person. Also, contact with respiratory secretions and with surfaces is also a possible way for the virus to be transmitted. And when I say surfaces, what exactly does that mean? Surfaces can be any object at all, as well as fabrics, which, for example, can be clothing, towels, bedding. Pretty much any surface is a possible way to transmit this virus if it has been used by someone with monkeypox. People can also be infected during intimate contact of any kind, as well as prolonged face-to-face contact. It is important to also keep in mind that although the monkeypox outbreak, it has been linked primarily to intimate contact among men who have sex with men, it can also be transmitted in other ways. For example, there was a recent case reported of a traveler who returned to the U.S. from the United Kingdom who did not report recent sexual contact. There was also a suspected case of human-to-dog monkeypox transmission. And so it is important that we are all vigilant because there are many ways in which this virus can be transmitted. It can also be transmitted by preparing or eating meat or using products from an infected animal, as well as it's also possible to get monkeypox from being scratched or bitten by an infected animal. It can also be transmitted through the placenta in pregnancy, as is the case with viruses in general. There are still a lot of unknowns about this virus, and there is ongoing research to see if the virus can spread when someone has no symptoms, as well as how often monkeypox is spread through respiratory secretions, and when a person with symptoms might be more likely to spread the virus through respiratory secretions. There is also ongoing research looking at whether this virus can be spread through semen, vaginal fluids, urine, and feces. So, how can you protect yourself from this virus? Number one, wash your hands as often as possible with soap and water. If you are unable to wash your hands, use an alcohol-based hand sanitizer. Number two, avoid close skin-to-skin contact with people who have a rash. And number three, avoid contact with materials or objects that a person with monkeypox has used. If you are concerned that you might have been exposed to monkeypox, or that you have symptoms that are concerning for the monkeypox infection and you don't have a healthcare provider or health insurance, please go to the nearest public health clinic. So I hope that this information was helpful, and that's all I have for you today. If you like this video, please like and subscribe, and I will see you next time.